One issue that's often a topic of controversy when discussing the medical care for detainees is the hunger strikers in the enteral feeding program. When a detainee misses 9 consecutive meals, he's considered to be a hunger striker. At that point, he's evaluated by medical, looking for any medical reason that he's not eating. Does he have belly pain? Does he have a toothache? Is there something medically that we can do for them to get them to eat again? They're also evaluated by our behavioral health colleagues, looking for any psychiatric reason that they're not eating. So are they depressed? Are they anxious? Are they psychotic? Once again, is there some kind of intervention that we can take to get them to eat again? At that point, they're counseled over the long-term risk of a prolonged fast, and they're monitored on a daily basis. Using specific criteria that we've adapted from the Federal Bureau of Prisons, we evaluate each detainee on a detainee-by-detainee basis, and as medical professionals, we meet and discuss them. When we feel that their fast has gone on long enough to detrimentally affect their health, we forward a recommendation up to the Admiral who runs operations. The recommendation would be to initiate enteral feeding. The procedure itself is no different from an enteral feeding that would happen in any hospital back in the United States. This is a typical tube that we would use. It's a soft, flexible rubber tube. Typically use a lubricating substance and a numbing agent on it. It's inserted through the nose down into the stomach. The procedure is performed by our nurse with the assistance of a corpsman. The procedure itself is also performed in a medical restraint chair. The chair is there for the safety of the nurse and corpsman performing the procedure, as well as the safety of the detainee. A typical feeding lasts between 30 and 45 minutes, and throughout this entire process, detainees are still offered 3 meals a day. One of the issues that often becomes difficult for us as physicians is determining which detainees are making this decision to be a hunger striker of their own free will. From what we can tell, from what detainees have told us, we know there's a level of coercion that exists within the detainees to be a hunger striker. We also have detainees who eat dates, honey, and drink coffee before they're enterally fed. We have other hunger strikers who complain when the nurse and corpsman show up late for their enteral feeding, asking where's the nurse and where's the corpsman. We have other hunger strikers on their way to be enterally fed are singing songs. It's a very different picture than what is portrayed in the media. For us as medical professionals, we have no way of determining which hunger striker is making this decision of their own free will and who is being coerced. From our standpoint, we err on the side of preserving life, and that's what guides our practice of enteral feeding.